program was designed to create practitioners who were versatile and conscious and flexible therapists who understand that the somatic body is where the healing of the mind and body occurs. Now, by the name of it, movement therapy indicates that we're using movement as a therapeutic intervention. So we are actually training students to become psychotherapists where they're using movement or dance as the intervention. It's the tool. This course itself was generated out of my years of experience of mentoring students who had trained in other types of movement therapy modalities, but they were missing some things, and that was an ability to analyze movement, to find a language for describing the nonverbal. So hence the name movement-based somatic therapy. Soma meaning the body, somatic therapy meaning that we integrate elements of the body, including touch, movement, verbal skills. So that's where the course truly is individual. And it was also based on the fact that people like myself and other trained dance movement therapists, we already knew that dance was therapeutic, but were wanting to take it a step level, a further step deeper to capture and address the non-verbal elements of movement and actually use it as therapy. So what's important for me to express before I move to the next slide is that movement is the key to understanding what is not spoken, but it's also an expansive repertoire that is significantly related to that individual. So we don't teach a method of movement, we embrace each individual and invite them to express what's personal to them. So what we're doing is healing through the therapeutic intervention. The movement itself is not healing. So that's my very, very strong point, that just dancing around a space and moving and doing expressive movement won't heal an individual. It's the connection between old movement patterns and the new ones that might emerge that are communicated through skillful movement analysis. And that's what assists the healing. And so the movement analysis is actually the essence of this course. So moving on to our next slide. I have introduced a little bit about what movement-based somatic therapy is, and some of the theories that underline this are Laban movement analysis. Anyone who's had a dance background may have come across this person, Rudolf Laban. He developed a method for describing movement, and we use some of his in order to record our therapeutic findings and to record the movement that our clients express and incorporate this into a language so that we can speak it back to them. And these techniques are necessary for all of us as movement therapists in order to create more positive therapeutic outcomes. Moving on to the next slide. As students who might enroll in this course, you'll be introduced to these theoretical frameworks through practical applications and movement experientials. So our teaching methodology is first and foremost based on the fact that any therapist cannot learn to be a therapist without undergoing their own therapy, so to speak, or going through their own experientials. So our learning has a three-phase approach, and every topic module that we go through this stage of movement experiential. For those of you that might not be familiar with that, that is being led through a session where you go deeply into exploring your own body. We then will discuss that and apply the theory that underpins that experiential, and then we will speak about applications in practical ways. Because in terms of vocational education, the beauty of it is that we're not just sitting in a lecture theatre and learning the theory. We are moving the theory, we're learning the theory, and then we're applying it. So how do we apply these theories? We use those incorporating somatics. Somatics is anything of the body, and this course in its development, we have chosen to use something called somatics. It's by a person called Thomas Hanna, bringing the mind. So we do at this point assist students in learning the whole somatic approach by teaching a set of exercises that are designed to take the body through its entire range of movement as a way of diagnosing where clients might have restrictions, pains, or an inability to actually perform certain movements because they've been denying that part of themselves for many years. Another way to look at movement is to go back to the pre-verbal stages where we look at developmental movement patterns. This is a really exciting part of the course because during the first 2 years of life in our pre-verbal stages, that is where most of our movement patterns are developed. It's where we develop as human beings, and it's also where much of our trauma occurs. So many people who come into therapy are dealing with issues that may even go back to pre-verbal times. And this is where movement therapy comes into its own most significantly, is that those of you who've had therapy and been to counselling, you can tell your therapist anything you like because we have to be in our heads to communicate that way. However, through a lot of the expressive arts therapies, we're using a creative format, and in dance movement therapy particularly, we're moving and the body does not lie. You can't actually hide things. And through the application of somatics, developmental movement, and the Laban analysis, we can explore parts of people's movement patterns that are dysfunctional or express areas that are needing a little bit of intervention. Now, there's obviously a technique for this, and we learn this within the course based on a model that we call the 5-part session. So each session on its own follows a particular framework to take clients into the transition from their daily world and to leave words behind and go deeper into the movement experiential, come back out of it, see where they went with it, and then there's a discussion so that we can intervene and make changes to people's lives, depending on what the issues are, of course. And the other part of the course is tactile therapy. In many verbal therapies and expressive arts therapies, the touch factor is left out. And my experience as a therapist has shown me that it's a really important part because many people who come with previous trauma, a lot of it is that they've left their bodies and they actually don't get touched. So we all know how great we feel after we've been for a massage, how our muscles relax. So the small, gentle touch that we include in our training is just to invite people to relax. We don't train people to be massage therapists or any type of body worker. It's more a somatic touch that assists release and invites people to not hold tension in areas they benefit from letting go of. So in essence, these diverse therapies will equip students and practitioners to use movement-based somatic therapy in their specialist allied health professions. So that leads me on to the point that this being a graduate certificate means it's a postgraduate qualification, and many of you will have come from various backgrounds, and so we use that experience of our students and use it as a learning laboratory, because the way that you might apply it depends on the work situation that you would be involved in. So I think you can see that. This is just another pictorial way of showing the theoretical foundations, the developmental movement we've looked at. And I think at this point, it's good to see that we also put in functional and movement analysis. Not everybody is comfortable with just freely moving, so functional movement means, in terms of the Laban work, that we look at the effort with which people move, the time that they take to move, the amount of space that they explore through the movement area, and what sort of force that means. Is it very bound and strong, or is it free and floaty, and does one movement flow onto another or not? And this will lead us to things such as emotional states and, of course, psychology. The psychology of touch, as I mentioned, and these things are all affected by people's development. And I often say to students that anyone who knows someone who said, my son or daughter, my baby never crawled, they just went straight to walking. Well, for us as movement therapists, we'd be really concerned about that, because we need to explore every single pattern, from being able to lie on your back to rolling onto your front, to being able to snuggle in and yield to your caregiver, to be able to reach out and take something in those first years, that's like food or a toy or something, to push, to be able to ground yourself. So that's the first component of walking. Be able to reach and pull yourself along the floor. So they're all things we're familiar with, but there's a lot of information held within them. And when we start to explore this as students in the workshopping, we move towards discoveries of something we've referred to as a personal movement signature. And I invite you all to actually ask yourselves this question: is it true what I'm about to say? I'm going to call this term a personal movement signature. And this comes from my belief that every human being has their own unique perceivable movement style. Now, myself, I become so fascinated with watching people move that even when I am down the street sitting in a cafe, I will watch people move. I will watch how they interact with people. It gives you so much information about human interaction, personality, etc. And with skills that you would acquire through becoming a movement therapist and the theory of Laban, you would be able to observe movement signatures in yourself first and foremost, and then in other people. So what we look for is recognizable movement elements that can be identified and categorized. And when we learn the Laban system of movement analysis, we do categorize into many sections so that repeatable movements can be actually identified in combined sequences, and then we can look for things such as effort, shape, space, and body. We're looking for idiosyncrasies, subtleties of being that each individual has, and it's extraordinary actually how much information you can get by observing people's movement, the liveliness of an individual, and something we call expression. It's how they express themselves and how much they know of their own expression, because often we have habits that we're not even aware that we do. So we learn a lot about ourselves in this course, and we learn about observing others. This is something that's probably many of you are familiar with, is the whole need for a modality that addresses contemporary issues of trauma in our modern world. And we've all heard the terms post-traumatic stress. There's a lot of refugees. Movement is actually being taken into refugee camps across the world, into some of the war-torn areas in Northern Africa and so on. And they're finding that it's been very, very effective. But that leads me to the fact that don't think that trauma means you've had to be hit by a car or in a war or anything like that. Our contemporary lives are very traumatic. We endure a lot of stress. We have a significant increase in breakdowns in family structures and relationships, changes in jobs, inability to get jobs, all sorts of things like that. And competition to succeed is so prolific in our society that people are just carrying around a lot of stress, and we see postures changing, people's breathing diseases, cancers and things like that. It's because there's so much tension within bodies. So no single modality at present is suited to all clients or all therapists, and this is something that I'm quite enamored of, is that we are drawn to a type of therapy that is best for us. So movement therapy isn't for everyone, art therapy isn't for everyone, verbal therapy isn't for everyone. So we have to keep that in mind as well. And what we're doing here is creating a complete theoretical approach to meet the needs of presenting clients. So they're the people that we see. And as a graduate of this program, you would be equipped as a therapist with the skills to apply verbal, tactile, and movement-based approaches as needed by a client. And sometimes we do find that in a session there is a small amount of movement. Other times there is a larger amount. But what is most important is that we'll teach an approach to client-based movement, tactile and verbal therapy. So it's driven by what the client needs and what they're presenting. And it's based on the understanding that somatic body is where healing and the integration of mind and body occurs. And in applying this movement therapy, I've given you indications that it's on a one-on-one basis, but we will, in many institutions, see group-based therapy. In my own experience, I have worked in child and adolescent mental health services as a movement therapist, running both one-on-one sessions with children with social, emotional and behavioural problems. I've also run groups for children and primary caregivers who've survived issues such as domestic violence, so that the surviving parent and the child can reconnect their relationships. Also worked in special education with adolescents who have mental and physical disabilities. Autism in particular and Down syndrome, really, really effective. Movement therapy is really effective with those populations. In mental health hospitals, people with bipolar issues, schizophrenia, eating disorders, they're all types of populations that respond quite well to this work. Most recently, I have been working with adolescent girls with eating disorders, and eating disorders are quite a challenging group because it's a really insidious illness where the person is actually sabotaging their own health and using food as the enemy. So yes, there is a mind-body approach that we have to take, but we also have to create some symbiotic relationship with food and teach them that food is a movement process and digestion and health and all that sort of thing. Improving body image and that type of thing works really well with movement. And another area where it's really beneficial is helping people make decisions about life in general. I'll share a particular example of how it can work is say someone would come into therapy not sure if they're happy in their relationship, their marriage, they're experiencing a lot of stress, conflict at home, that type of thing. We can talk about that, we can look at options, but how movement therapy works in that particular example is that you could divide the room up into 3 sections. One area would be the past, one area would be the present, and one area would be the future. And I am simplifying this quite a lot, given our time frame, and I'm not doing the whole training course in 45 minutes, is ask the client to move in any one of those areas to start with. But you look at their movement patterns, how do they move when they are in the present? Then you ask them to move to the past or the future, wherever the other places are they haven't been. And then the work happens when you ask them to find the transition between the past, the present, and the future. And it is amazing how you can observe people just can't go from the section in the room that is the present to the future because they're not ready yet. They don't have the tools. Yet they can move and they know what it's like to be in the future, but they haven't got that the skills or the tools yet. So that's where we would then focus the therapy on, establishing those skill sets to give them strength and capacity to make change in their life. And then as a therapist in that same example, I would use the observation skills through Laban movement analysis to observe and document issues that I see reflected through their movement patterns, and then I would discuss it with the client. So another aspect of the course is learning how to plan and deliver movement therapy sessions. So we teach a lot about movement strategies and ways that you incorporate these into somatic movement therapy. And all of this occurs within the context of allied health. As I said before, sometimes we have many different allied health professions in any particular cohort, and examples in the past are I have had men and women, which is, it's always good to have both sexes in a movement environment because our culture says that boys don't dance. Well, they do, they move. So examples are, I have had a corporate manager who was running workshops on conflict resolution in high-end corporate businesses, and he did the course. I have had people who have been verbal counsellors, artists who are wanting to bring a more movement dimension to work that they do, massage therapists, social workers, life coaches wanting to add another dimension, teachers, healthcare practitioners who do work with the body, like I've had physiotherapists as well as massage therapists. So quite a wide variety of people are drawn to this sort of training. And I always have a fond memory of one student in particular who was a 6'4" striking man who was an ex-SAS soldier who had become he was a Pilates instructor, and he was drawn to doing this course. But he said to me on day one, "I don't dance." And I said, "You do, but that's fine if you don't dance." And each time we'd have a movement experience, in my view, he would dance, he would move, but he would say, "Just remember, I don't dance." And then on the last day of the final coursework, he said, "Actually, I've been dancing all along, haven't I?" And I said, "Yes, of course." And he's gone on to now, he runs his own private practice, and he does work a lot with chronic pain and people with limited mobility as a result of this, particularly arthritis and back injuries. And interestingly, he rang me just before Christmas, and this was very endearing to me to have a student come back who's got a successful practice and had undergone a lot of change in his own body and life throughout the course. But his mother had died just, the week before this, a few days before Christmas. And he rang me to say that everything that he learned during this course, while it informs his work practice, was the most significant learning. The most significant learning was through the process of him writing his mother's eulogy. And in order for him to stay focused and not be driven by the emotion that was there, obviously because of the sadness, he applied one of our basic underpinning theories, which is that of the felt sense. So not giving into emotion, but staying present in the body and observing sensations that come up. And he said that was the most powerful thing that helped him be able to deliver the eulogy and prepare it. So for me, that's a wonderful feedback that I can see that students go and use this wonderful method in all aspects of their lives. The other aspect of the course is designing and delivering somatic tactile therapy, somatic psychotherapy applications for specific populations. As I mentioned before, there's really no end to the types of populations you can apply this work with, and it's very effective in schools with kids these days. I'm sort of reminded of I have had years of experience as being a school teacher and then working in special ed, but working with children that just can't focus. And I think it's becoming more of an issue today, without sounding like an old fuddy-duddy, but I do question what will be the long-term health and developmental movement issues that children face because they're in front of iPads and computers so very early on, and their fine motor skills must be not developing as well as maybe they have done in the past. So I've found that going into schools and working with children that are having reading difficulties and behavioural problems, actually getting them to move in their bodies assists in quite a big way. You can see I've been playing around with PowerPoint, making it a little jumpy, just in case you're getting bored there. Okay, just to summarise, these are in essence the underpinning theories that we will explore through a movement-based somatic therapy training course. The Laban movement analysis, the dance movement therapy, somatic awareness, psychodynamic stance, so that's coming from a psychodynamic therapeutic framework, and something I haven't mentioned before is Bartenia fundamentals. And these are a series of exercises that follow the sequence of the developmental movement patterns, and we've developed a sequence of them so that students can go away with a toolkit, if you like, to get started. And if they're facing clients who just aren't comfortable moving freely, then they can start with some structured movements. We also look at, as I said, the client-centered therapy, and look at some of the applications of self-psychology. So who would need to use these techniques? In essence, any professional wanting an integrated and holistic approach to healing. We often find that it's people that have been practicing for a while and want to add another dimension to it. Particularly verbal therapists, even psychiatrists that I've spoken with will say they can only go so far because people are held in their heads. And this is a way to help us integrate what their thoughts are with actually what their body is telling them. And believe me, in our culture, we're encouraged to deny what's going on in our body and soldier on and take a pill for the pain, or just be a good boy and get the job done. So our work encourages people to really look at what's going on in the body. And so that's the question for people drawn towards movement therapy, is that the question of, like, how do we as counsellors and therapists can connect to the full complexity of another human being? And in our work as therapists, words are important, and we're trained to listen carefully and deeply to our clients. And our deep listening is usually done through what we call empathic attunement to the feelings and the affects that our clients reflect to us. But it's through a narrative of words, and if we can incorporate a narrative of movement, we actually increase our learning, increase our dialogue exponentially. Because, in fact, much of the expressive elements of any individual are not spoken. Even when you're in a conversation with someone and they talk to you, if you look at what their hands are doing, what their eyes are doing, how their face is animated or otherwise, their body posture, that's where the information lies. It's presented non-verbally, and it's the stuff that informs us. And so things like gesture and posture and expression are the key to our intervention process. So, and they're the key to it, but then where the effectiveness comes in is our skills with languaging the non-verbal. And this is where, if we try and interpret what people say, we can maybe make inaccurate observations, and then make us rush to urgent interpretations because we want to help our clients. Whereas if we can gather information to form a body of data through observing a moving body, then we're more equipped with more information, so that our words are actually more informed, and we've got a lot more information to dialogue with our clients. And so we really are, as therapists, we're scientists. We're gathering data by observing, we're collecting it and categorizing all this non-verbal data so that we can put it into a language that's appropriate for future dialogue with our clients. And we've developed something called a system of movement analysis that follows these frameworks, incorporates all of these theories into a little framework to assist students learn how to do this through their training and then apply it in their practice. And given that I think the statistics are that all psychotherapy and counselling is interactive and it's intersubjective, and my alarming statistic is that 80% of communication in any therapeutic situation is non-verbal. And so I reiterate, as therapists, we see clients who, for various reasons, have few words. And I mean, when you do have issues that you seek out therapy for, usually you're stuck. So you don't have words to describe things, you have feelings overwhelming you, and you have memories that are trapped in your bodily systems. You might have frozen postures and painful muscle tension. So you need to be brought to a place where you feel safe to explore a letting go. And this can be, it can take, many sessions, because we do have clients whose childhood developmental trauma, originating in really early pre-verbal years, as I said earlier, is locked up in memories. They don't even remember it. It's there in sensations and feelings, and it is evident in their movement patterns. So we refer to those as somatic markers, and we try to identify them so that we can guide clients to make associations between certain stimuli that maybe bring up past memories, and invite them to associate them with physiological effect that is evident in their current movement patterns. And the thing that we work with most, and which is really effective, is teaching people to do something such as a somatic check-in, which is, what am I sensing in my body now? Not how do I feel? I'm fine. I'm angry. I'm sad. It's more, I am sensationally in my body sensing tension in my right knee or my left shoulder. And when we ask people to go into their body, it's amazing what information they come forward with. So who are the people that might come to this sort of modality? And I've mentioned many of them previously, but here's a list so you can just see in front of you. Many in the allied health area, people working in communities, working with groups, nurses, particularly cancer care nurses, find that it's really wonderful work. When people are near death, they really go into their bodies, and we find it's a very beautiful way to help people accept what is going on in their body that's out of their control. And getting towards the end of our time, my presentation, before we hand over to questions, just summing up to express that this graduate program is offered all over Australia. It is purposely designed for a vigorous professional training. You will go deeply into your own work, your own personal journey. You will come out with exceptional skills in the application of a language for describing unconscious and nonverbal behaviours. And well, we already know that it's recognised by ASQA, includes a combination of classroom delivery and virtual online learning strategies, and it's supported by your own experience in particular workplaces. We call this clinical practice. So you go out and you're under the supervision of someone working in the area, or you form your own groups and run your own groups, and we provide assistance and feedback and monitoring via our online support. This is the delivery. I'm not sure that we need to go on about that too much tonight, but we do have classroom delivery, we have the online stuff, and self-study where you will complete your own assessments and your clinical practice, personal therapy sessions as well. And this summarises some of the therapeutic engagement outcomes where you need to consider, if you're interested in working in this area, the areas that you would work in, the types of relationships as a therapist you would develop with a client, understanding the self in front of you, that's the individual, so that's that intersubjectivity that occurs between a client and therapist, and understanding how a person organises experience and becomes the person you are working with. So learning to get to know the person who is your client through methods that are not just what they are telling you. We look at the LABAN stuff. There's also a lot of anxiety that comes up when people go deeply into their body. So there's a lot of emotion that is released. There's a lot of self-discovery, and there is also a lot of movement. So I hope I've been able to express to you that this form of therapy does have structure, it has theoretical underpinning knowledge, but first and foremost we use the body. And our work in this course is to get students to explore their own bodies. And we come to it with a openness and a desire to move and really explore what your body's potential is. And we'll just finish with this slide, which is those things we will affect through a movement process is empathy as therapists, attunement to our clients as therapists, and a positive affect. That is our clients' healing, becoming well, becoming more functional in their lives. And often what we think the client needs isn't what they need, but we discover it together, and this is a result of the attunement and the use of the LABAN analysis work, the use of movement, and the way we use movement to connect to the clients. And I'm now aware, Kathy, that that's my 45 minutes. Do you want to say something here?
I certainly can. Thank you very much, Tracey. Look, I know I certainly enjoyed that, and look, it just reiterates what a rewarding career movement therapy would provide. And to quote you, using movement to help others build strength and capacity to make changes in their life. Wow, and what fantastic work that you're doing. I'm happy to open it up to questions. We've certainly had a few along the way that we've answered. So if anybody's got any additional questions, just type them into the chat box and we'll answer them. I guess one question I've got here is just regarding employment opportunities. So private practice obviously is one opportunity and one in which, as you mentioned, movement therapists can work. What other job descriptions or workplaces do you find a movement therapist would be a welcome addition to the team?
I had an example yesterday of a student who has just landed a job in an aged care facility. More commonly, there is a job description called a diversional therapist. We're trying to incorporate movement therapy into those aged care facilities, and we're finding that some places are seeing that there is a difference between being a diversional therapist and a movement therapist. So we're in many places around Australia where our population of aged people and aged care facilities is increasing. So there are certainly job opportunities there. Special education unit, very much a place where movement therapists get work. As I said, in mental health clinics with private mental health clinics often have more funds to employ people with these skills.
Yeah, that sounds excellent.
Yeah.
Yeah, and that's something that we've found with our art therapy and drama therapy qualifications. We certainly encourage people to apply for jobs, perhaps where they're looking for case management, counselling, etc. background, because as you mentioned, there is a component where they obviously learnt the talking counselling skills, and it is a case of having those additional skills and recognising the non-verbal communication that, as you said, could be up to 80%, and having those skills to address that as an addition to the team. So that's excellent. The prerequisites, I've got a couple of questions here. It is a postgraduate qualification, so could you just outline perhaps the prerequisites and what somebody could do or the path they could take if they weren't eligible for the course based on their background?
Yes. Yeah. Basically, we like to see that people have had some experience in allied health, or at least have some undergraduate qualification that involves working with people, communicating, that type of thing. It's it's not a prerequisite, but it's desirable qualification that indicates that you have applied yourself to the study, that you've worked in a field with people, and that you're seeing that you want to expand your skill set, or going to a complete career change. And obviously whatever experience you've had is informing your decision to move into something different. So we do tend to take it on individual cases. We wouldn't take someone straight from school with no qualification, because you do need to have life experience so that you can actually, so we bring examples to the training. I'm also seeing another question here about, do you use music in your therapy sessions? I will answer that. And the answer is absolutely yes. Music is a really important component of it, but we don't use it gratuitously. We don't just put on in the background and say, dance to this music. Music is chosen very, very carefully, and often we won't use words unless we feel that that's going to, the lyrics would benefit that person. And often we will use silence purposefully as well, because it's just as effective. So we don't call ourselves, we aren't music therapists, but we do use music as a tool. We also use drawing at the end of an experiential. We 90% of the time we'll finish with an attunement drawing where we just express the movement in a two-dimensional form on a piece of paper. We don't create drawings, we just move whatever has been moved and express it on paper.
Excellent.
Can I give an example of how you would treat a client with his pain relating to childhood emotional trauma? That's a very broad question. An example might be that and a person might not present with a childhood trauma, but it might be evident in that individual's ability to make lasting long-term relationships. Commitment might be the issue. So we would look at, in terms of developmental movement patterns, whether they'd gone through that yield, push, reach, pull type of thing, and do we do a lot of relationship work about giving and taking, receiving, caring through movement exercises or experientials. So we would, I don't know, it would depend what the dysfunction is, but if it is about forming relationships, or it's about standing up for yourself and saying no, or being able to share, all of those themes pretty well can be traced back to some sort of developmental, not necessarily trauma, but developmental issue that wasn't addressed in those first 2 years. And I'm not saying that every dysfunctional behaviour pattern in adulthood can be traced to one particular event in pre-verbal years. It's not that simple. It's a complex formulation that we gather information about and then deal with the individual. I hope that helps. What type of fitness level is required? None. It's really based on your own individual ability. Some people think, oh, but I can't do this, I've got sore knees and I can't do that, because it's movement directed from yourself. We do find it's useful to be able to get down to the floor and up, but if people have limited ranges of movement themselves, it doesn't mean they can't be an effective therapist. So we can sit in chairs, we can stand, those types of things. And I always say to people when engaging in a movement experiential, you are your responsibility. So only move as much as your body will allow you to, so whatever energy or energetic levels you have.
That's excellent. Look, I'd just like to add a note about the online component of the course. As with all IKON courses, we recognise that to learn to work with people, it is essential that you do work with people to learn that skill. So our approach to online learning is based on best practice models, whereby the home component is learning, reading, information, etc., that you then go in and practice and discuss with some sort of knowledge, obviously, before you enter into class discussions and with your classmates. So we do get that question a lot, especially with other courses such as the Diploma of Counselling, the Diploma of Youth Work, which are offered with some institutions or colleges in 100% online capacity. It's not something we will do ever, with that importance of the contact and learning from people to be able to work with people. So I just thought I'd add that. There was a query about the online, so I hope that addresses that one. Are there any further questions? I think otherwise we're about due to finish on time, which is fantastic. When does the graduate certificate start? There are individual start dates. Alicia, have you got them handy with you? You there, Alicia?
I am, yep. So we're yet to schedule the movement therapy in Western Australia at this point, but we are hoping to get it off the ground for a mid-year intake. Anyone who wants to be notified for specific dates, they can just contact us at IKON, and I'll be happy to put them on a list, and then we can contact them. In South Australia, we're hoping to get that one off the ground in around March, and Queensland likely a mid-year intake as well. But as with all of our courses, if the interest is there, then we'll certainly look at scheduling it a little bit earlier as well. So aiming for March in South Australia and mid-year for Queensland and Western Australia. But again, I encourage you to register your interest, because if the interest is there, then we'll certainly look at scheduling the course.
Excellent. Thank you. Okay, I think that's all of the questions. So a bit of feedback there. I might have to mute other people. Excellent. Okay, well, thank you very much for your time and for your interest, everybody. You will be sent a copy of the recording tomorrow. But obviously, if you have any further questions or want some further information, please make contact with us. We have open days as well. If you'd like to come in and visit our campus, just jump onto our website or make contact direct with us via email, and we can provide that information. But otherwise, thank you very much. Thank you for your participation, and thank you, Tracey and Alicia, for your assistance. Good evening.